Brian Smith, Executive Director and Chief of Operations of First Aid and Safety Patrol, and then the Vice President of the Lebanon County Ambulance Association.
Good morning. Thanks for having us. I'm Steve Merzowski. I'm the President of the County Ambulance Association.
Okay.
Morning, my name is Scott Beakley. I'm the Program Manager for Lifeline EMS and also the Pre-Hospital Coordinator for the Penn State Health System.
And Vice President of the...
And Vice President of the Council, yes.
Welcome this morning, and we have proclamation.
Yes. Whereas emergency medical services are a vital public service, and whereas the members of emergency medical services teams are ready to provide life-saving care to those in need 24 hours a day, 7 days a week, and whereas access to quality emergency care dramatically improves the survival and recovery rate of those who experience sudden illness or injury, and whereas the emergency medical services system consists of emergency physicians, emergency nurses, emergency medical technicians, paramedics, firefighters, educators, administrators, and others. And whereas the members of the emergency medical services teams, whether career or volunteer, engage in thousands of hours of specialized training and continuing education to enhance their life-saving skills. And whereas it is appropriate to recognize the value and the accomplishments of emergency medical services providers. Now therefore, we, the Commissioners of Lebanon County, do hereby proclaim the week of May 20th through the 26th of 2018 as the Emergency Medical Services Week within the County of Lebanon.
Move to approve.
Second.
All right, I have a motion and a second to adopt the proclamation honoring the emergency medical services in the county. All those in favor of adopting that proclamation indicate by saying aye.
Aye.
Any opposed? Congratulations, you have a proclamation. The folks would like to share something with us?
Sure. I'll allow the group to comment. I just want to say thank you for having us. This EMS week is next week. We've partnered closely here in Lebanon County with our folks at WellSpan Good Sam. We'll be doing a picnic at the ER parking lot on Thursday if you want to come by and thank the emergency responders in the area here. But it's a good group and a business that is just getting more and more tight with reimbursements and finances, but a necessary public service. The only other thing I wanted to mention was this week, currently, the National EMS Memorial Bike Ride and Service are happening, and not that we are happy about it, but we do have a Lebanon County EMS provider who is being remembered for a line of duty death during that service. So I can, Brian, maybe speak more to that, but Greg Wenzel is one of his providers that's being recognized this year. So it's a good week for us to take a step back and just remember who's out there and recognize what what those folks are doing to keep the community safe.
That's a good segue into, we've discussed in the past about all the great things that I think we're all doing, and the evolution of EMS and where it is today versus where it was just 15, 20 years ago, and the impacts that we're making on the community. But none of that's possible if it isn't for the individuals, the providers, and this is not an industry you get into because of the money, whether it's volunteer or it's a career. And so Greg Wenzel will be memorialized this week at the National Memorial. It's at the Gaylord Conference Hotel just outside of DC in Maryland. A couple of things that are going on for that include it's called the group called the Money Angels. It's a bicycle group that rides in memory of somebody. So we have there's an individual who's riding bicycle from Boston down to DC, wearing dog tags with Greg's name on them. His wife will be down there on Friday when they arrive, and will receive those dog tags, remembering Greg as well. On Sunday, the local Emergency Health Services Federation region is doing a motorcycle ride, and they raise money to donate to the Money Angels, who then donate the money to the memorial. And they'll be making a stop at our station around 11 o'clock on Sunday to pay tribute to Greg and the years of service that he provided in Lebanon County.
Very nice.
I'll just echo what my colleague said, and not just for Lebanon County, but I think for all of South Central Pennsylvania, the citizens who live in these communities, I don't think at times they realize the level of emergency care that they have. When you compare the level of not only EMS but police and fire response as well, but with regard to the level of EMS care that we have in this area, just the healthcare system as a whole, even amongst all the competitor hospitals now in the area. compared to other areas throughout the country, we are very, very fortunate citizens. I mean, I myself am a citizen of Lebanon County, you know, and work for the Penn State health system. But yeah, I cannot say enough about if you get sick or injured in this area, you are in very, very good hands from the moment the 911 call happens to the moment you walk out of the hospital and then any follow-up treatment there. And EMS is also in a position now where we're reinventing ourselves. We were just having a conversation out in the hallway about the community paramedicine programs and just different things that the EMS services are now doing. First aid and safety and Lifeline Low are community paramedicine programs which are preventing readmissions for patients that, you know, would fall through the cracks in other, you know, other health systems and other EMS systems. So we have various programs in place that we're preventing those patients from falling through the cracks. So EMS is truly your frontline healthcare provider. So we're very fortunate and also very thankful that you know, the citizens and our elected representatives take the time to recognize us. So this is a very thankless job, and you know, we're not in this for the awards and stuff like that, but this is a special week for us, and we do appreciate it. Thank you.
Thank you. Yeah.
Can I mention, you also, or would you mind mentioning, you also handed out an award last week, I guess, within your organization. The commissioners provided a recognition for it.
Sure. So Howard Kramer, who's been a long-standing first responder, both in the fire service and in EMS from Schaefferstown, joined us last week. He was presented the Ralph Backenstoss Memorial Lifetime Achievement Award for EMS from the County Council as well as Good Samaritan Hospital. So thank you for joining us, but we recognized Howard for his years of service.
Okay.
Thank you very much. We
Thank
appreciate your time.
Appreciate it.
Sorry.
Are you still having, I remember one time you were having difficulties getting people interested in emergency medicine, being EMTs. Has that ended, or do you still have staffing issues?
Well, I'll speak to a collaborative that we've done here in Lebanon County that's been hugely successful. We started a program about 3 years ago where the Ambulance Association really is kind of the parent, and then we've created a consortium of EMS services that have bought in, if you will, to providing an EMT education here in Lebanon County. So we are doing an annual EMT certification program that begins in August and ends about the January-February timeframe. We have consistently over the 3 years had nearly 19 to 20 students that have taken part in that. And if you can go prior to those years, there was no class in Lebanon 4 out of 5 years. In the 5th year that there was a class, there were only 6 students in the class. In addition to that, we've, I will say, bolstered our partnership with the Elko School District, who's had an EMT program for 35 years. That program continues to have 20 to 24 students in that. And then this year, we started the same program at Cedar Crest High School. This year, we had 32 students who participated. We had 21 of those who were eligible to take this national registry test. We have 52 that are interested in the program at Cedar Crest next year. In the last 3 years, we've educated over 150 individuals in Lebanon County to become EMTs. And it's been, we had a bleed that needed a tourniquet. And we put the tourniquet on, and now we've addressed the why it was bleeding. And I believe that we're on the path, both in the career and the volunteer segment, because it cannot go unnoted that the importance of our volunteers that still exist at Vaughan and Myerstown, Schaefferstown, and Newmanstown, and the quick response units, and we've seen, we've hired probably about 19 over the last 2 years from those programs. So it's been, I would never sit here and tell you that there's not a continued need, because with the projections from aging and the demand on the EMS system, it's only going to grow. But we have certainly acted to do something very important in stopping that bleeding.
Thank you.
And that's an incredible program, obviously very successful, so very successful.
What is this?
Congratulations on that.
What is the starting salary for an EMT that's gone through your program?
So it's variable depending where they end up. I would say that if you look at median wages across the country, I think the National Labor statistics say that a median wage for an EMT is somewhere around $28,000. Locally here, you're around 10 to 14, depending on service level as a starting. So it's, again, it kind of supports my discussion earlier that nobody gets into this because of the incredible money.
And is that a full-time position, or
Yep.
doesn't it?
Like for our organization, we have, full-time and part-time EMTs and paramedics, as does Scott, and then we have, volunteers who do it because they care about the community.
It should be, it should be noted that these agencies run on a very thin margin. Reimbursements from even commercial insurance payers aren't covering the cost necessarily all the time. So it's what pigeonholes the folks into a salary at that level.
Our system at First Aid covers a large portion of Lebanon County. To operate our system at current status, it costs $700 per hour to operate our system. And an average reimbursement of, Medicaid at $120 and Medicare at $240. It's tight margins.
Gotta be tight.
Tight margins is a good way to put it.
This industry is also struggling with retention because people, you can't raise families on $28,000 a year. So, even being part of a hospital-based system, we see a lot of people who go on and, move to other healthcare jobs or get out of the field. We compete regularly with the municipal county-run fire departments down in Maryland and Virginia and so forth. I just recently had a paramedic leave to go to one of those paid fire departments. So it is harder to attract the millennial crowd into this type of work, and then retaining them is equally as challenging. So, but the need for EMS is growing more and more. So that's why it's we're very good at working very short and doing what we do. So, but I wish I had if I had a magic answer to that, I think I'd be on the lecture circuit. But so that's the other thing we have to do, is try and reinvent ourselves as far as how do we retain these people and keep the level of care out there. There is a very drastic shortage of paramedics in the Commonwealth of Pennsylvania, as across the United States, but we're really seeing that now in the Commonwealth as well, and it's difficulty getting people to want to go to paramedic school. So you can go and become a paramedic and start off maybe working for $30,000 to $36,000 a year. You can go to nursing school and come out making $60,000 a year. So, and depending on what type of nursing you specialize in, you can make even more than that. So when you're up against those kind of challenges within the healthcare industry, it is a very interesting line of work that we are in. So.
We appreciate your time.
Just get a clarification on something. You were talking about the salaries. You said 28,000 was an average, and then you said locally 10 to 14. Did you
10
mean
per hour.
That's an hourly.
Yeah.
Right? I just wanted to clarify that.
Yeah,
That was-
appreciate that.
Just went
I
from
heard
28
some
to 10
woos
to-
back here.
That's-
People
I
had
did
their
too.
salary cut in half.
We appreciate it.